BMI, waist circumference, salt intake. There are a lot of numbers to keep track of when it comes to staying healthy.
Well, here to walk us through the ones that you need to know about is women's health contributor Dr. Keri Peterson. Keri, good morning.
Hello, Keri. Good to see you.
So these numbers can be confusing, and you've selected 5 that we need to know about. Let's start off first with the number 25. This pertains to both men and women.
This is your body mass index that you should be below. Okay. And this is a relationship between your weight and your height. And it gives doctors some sense as to whether you're prone to weight-related illnesses like high blood pressure and diabetes. So if it's above 25, you're in the category of overweight, and if it's above 30, you're in the category of obese.
Obvious question, Keri. How do I measure that at home? I've got a scale that tells me how much I weigh. How do I find BMI?
Because it's a ratio of your weight and your height squared, it's actually easier to go online and do a weight calculator.
Okay.
And interestingly, men and women actually are calculated identically, but men tend to be more muscular, so their BMI may be a little higher. So some people question, well, why is there not one for men and one for women?
Yeah.
But the reality is that the ill health effects of BMI are equivalent for both sexes above 25.
Okay.
All right. Important number to keep in mind. Okay, next one is 16, and this has to do, and this is for men and women, has to do with the respiration rate.
Yes, this is your number of breaths per minute that you take. The average is between 10 to 18, around 16. And if you exercise, of course, it's going to go up naturally. This is when you're at rest. And when it's elevated, if you're at rest, it can be a sign that you're stressed or that you're anxious, that you have a fever or you're dehydrated or that you have an infection or lung disease. And if it's too low, could mean that you had some alcohol or were taking some painkillers.
You just had me counting my breaths while you were talking.
I know.
It's in my head right now.
It's hard to do.
Yeah.
How do you get an accurate measurement?
It's so hard to do it on yourself because if you try to, you breathe faster. So what nurses do in hospitals, they trick patients. They pretend they're taking their pulse and they look at their chest rise and fall. So have someone watch you breathe.
Okay, cool. All right, let's move to our next number. 40 and 35. This is about waist circumference. What are the two numbers?
So for men, it should be under 40. For women, it should be under 35. This is the inches around your waist. And to do that properly, you want to do it above your hip bone, just around the belly button, and you get your measurement.
Okay.
And it's another reliable indicator of your fat levels. And it's in particular regarding your visceral fat, your abdominal fat. Leads to diabetes, high blood pressure, high cholesterol, heart disease. And this fat is not just sitting there. It's metabolically active tissue. It produces inflammatory chemicals, and it prevents you from responding to appetite-suppressing hormones called leptin. So you get hungrier the bigger your belly is. Counterintuitive.
All right, well, let's move on to our next one. This one is for men and women alike, and it's the number 6. This applies to the added sugar per day, the grams of added sugar per day. What do we mean by added sugar?
So added sugar is that what's not innately found in food. Fruit and milk have innate sugar in it. This is what's added during processing or during preparation. And the American Heart Association says females should not have more than 6 teaspoons a day, which is about 100 calories. And for men, no more than 9 teaspoons a day, which is about 150 calories. So some tips: use fresh fruit rather than using any added sugar, and use spices like cinnamon or allspice or nutmeg to replace the sugar in your food.
Is that easy to find on a label? How do I know if I have added sugar?
It is
Just
a little tricky.
Look
at the grams of sugar.
Okay.
And 1 gram of sugar is 4 calories.
39 grams of sugar.
So there you're already almost 200 calories. So you should really limit it. Women to 25 grams, men to 37 per day.
Okay. All right, let's go to our last number. 1,500. We're talking about milligrams of salt here.
Milligrams of sodium. It should be under 1,500 for 5 groups of people. Over 51, African Americans, people with diabetes, high blood pressure, or kidney disease. For everyone else, it can be under 2,300. But ideally, if we can do it, we should all go under 1,500, because if this country all drop their salt intake to under 1,500, the number of people that have high blood pressure would drop by 26%.
And 1,500 milligrams, just to put it in layman's terms for people who aren't good at figuring out what are we talking about.
You'd have to look on the back of the label, and it will tell you the number of milligrams. It varies so much. Even from one brand of chicken soup to another can vary from 200 milligrams to 800 milligrams. So you really have to look at those labels. And the average person takes in 3,400 a day. So we have to do a better job at this.
It's terrible.
Yes, cut it out. Use spices instead, fresh herbs. They can replace salt.
Maybe the Super Bowl Sunday, that was not the time to start. We'll wait till Monday. Monday. We'll start Monday.
It's going to be sodium overload and sugar overload for lots of people. Keri Peterson,
Thanks,
not
Keri.
to mention overload of lots of other things.